Yeah,
exactly.
Last time I
That's
looked,
even true.
at least I knew it was coming. I didn't.
My kid walked out the door at 8 o'clock. I mean, he must have gone somewhere.
We are now upstairs.
Okay, well, good afternoon, everybody. My name is Mickey Varney and I'm the chair of the Climate Action Plan Committee. It's Monday, October 20th, 1 p.m. And here, committee members here with me. Would you go around and introduce yourselves, please?
Shay Matthews. Paul Tigan, Ward 1.
Linda Nishioka, alternate.
And online?
Good afternoon, Vanessa Nordyke, Ward 7.
Muted. Councilor Nordyke's online.
You can hear me, right?
Doesn't look like she is. That might be a.
Okay,
I
okay.
see Krishna nodding, but I think the room.
That cleared up. And staff members who are here, could we just go around the room?
Absolutely. Brian Martin, Public Works Director.
Thank you.
Juliana Douglas, Climate Action Plan Committee.
Excuse me, Jason Pulley, Utility Planning Manager.
Meredith Greer, Natural Resources Planning Manager.
Thank you. And we,
I'm Tila, the Climate Actions Audit Intern.
okay.
My name is Michael Coiler. I'm Marion County Climate and Health Adaptation Plan Coordinator.
Yeah. Well, thank you. Welcome, everybody. Oh, and online, we still, hi there. We're still having some audio problems. Like we can see you.
Is it muted on the? No.
Krishna Namburi, City Manager.
Sorry. That's okay. That's okay. Not muted here.
Jeff Johnson, Natural Resources Planner.
Can you try speaking now, someone?
This is Vanessa Nordyke, testing 1, 2, 3.
Okay.
Okay, okay.
Did that work?
Hearing us just fine. Yeah.
There we go. Yay.
Sorry. Oh.
Uh-oh. I love technology. Oh my gosh.
Oh, this is gonna be terrible.
I think we have it figured out. Sorry about that technical difficulty.
Councilor Nordyke, you want to give us another try?
This is Councilor Nordyke. Best ward in the city is Ward 7.
While you sit in Ward 1. Okay.
Okay, and staff members online.
Krishna Namburi.
Thank you.
Jeff Johnson, Natural Resources Planner.
Excellent, excellent. Well, great. As I said, welcome everybody. So first thing, do we have anybody signed up for public comment at all? And I don't see anybody online. Okay, all right, moving forward. Next item on our agenda is approval of our June 16th, 2025 meeting minutes. Is that June? I have the right one. Was it really that?
It says.
Okay. I am thinking,
No, that was the August minutes. I'm sorry.
that's okay, that's okay. I'm just checking the minutes here to make sure. Okay, I have the right one. Yeah, it's could I have a motion to approve the August 18th, 2025 minutes?
So moved.
Second?
Second.
All in favor, say aye.
Aye.
Aye. Any opposed? Seeing none of the minutes are approved. All right, first on our agenda, we're fortunate here to have Michael Cooler, is that how you pronounce it?
Coiler.
Coiler,
Yeah.
Coiler, okay, and he's the Marion County Public Health person, and you're here to present the, Marion County Climate and Health Adaptation Plan? Is that what it is?
Yes.
Okay, all right. Thank you for being here. I'm looking forward to hearing about this.
All right.
Sorry, if you want to present.
Oh, sure. I can do that. Come up here.
Did anyone tell you when you gave a presentation, there'd be 6 versions?
I know, it'd be everywhere.
On display. This is the best part of this room.
Oh, wow, it's like full.
You are.
Surround sound.
Follow you around the room.
Sure, you are, it's more immersion, right?
All right, thanks Juliana for the invite and for everyone welcoming me here. Again, my name is Michael Coiler and I am the Environmental Health Resiliency Coordinator. I oversee Marion County Health and Human Services Climate and Health Adaptation Plan, where we went through a large and long, lengthy assessment and planning process to create, hopefully, a more vibrant, healthy, and prepared Marion County, including Salem, that is resilient to periods of extreme heat, extreme cold, and poor air quality. We at the health department have gone through, like I had mentioned, some assessments that led to a planning process, and now we're in the implementation stage of this climate and health adaptation plan. Within the assessment process, I actually left some of our assessments there. So if anyone's interested in taking a look at some data, there are some reports that I brought. I also brought some of the climate and health adaptation plans themselves. So if you feel like thumbing through them, I'll be going over a general overview. Feel free to take a look. But we worked with Willamette University to conduct an environmental scan, and that process was to try and get an idea of how our environmental hazards like extreme heat or heat waves, ice storms, and things like poor air quality days, wildfire smoke, things like that. How are those things affecting people who live in our various communities? Within that, we also did some assessments around what does it look like in regards to how extreme heat, extreme cold, poor air quality, how are those things affecting our emergency departments, and when you compare those to temperature and air quality. So we did some assessments to get some baseline information, and that led to our planning process. Our planning is focused on adaptation, resilience, and preparedness. And so we're really kind of on the downstream side of climate and health, but that is based off of the funding that we're getting from OHA. The planning process we try to make as collaborative as possible, so that way it's not just initiatives that we're looking into as the health department, but also to try and increase collaboration and lift up some community efforts as well. So keep that in mind as I kind of go through this. We had over 65 different partners involved. I think Juliana is right there. I was like, are you in one of these pictures? And I found you. So she was able to help with that, as well as many others throughout our community. And we used some of the local data in order to make proper plans and create goals. And so the implementation, we have now over the next 5 years for our 5-year plan, 43 different objectives and initiatives, and a lot of those objectives are continued action items and partnerships that we have with different community partners to try and make some improvements to resilience. Why did we complete a climate and health adaptation plan? As everyone knows who went through some of our state of emergencies for natural hazards, we have had extreme heat waves, some record-breaking ones, both in 2021 with the heat dome, and then in 2024 we had the most days over 90 degrees. in history, and we tied for the most days consecutively for 100 degrees or more. We've had winter storms that have caused infrastructure issues, but of course also some cold-related illness issues, and then also smoke and wildfire from the Beachy Creek and Lionhead fires, which affected about 30% of Marion County's landmass and caused some of the worst air quality in the world in the Salem area during that time. With the information that we're able to get from emergency department and urgent care visits, we're able to see that there is an increase in different metrics that we're able to pull from that data. That includes heat-related illnesses, cold-related illnesses, and let's see if I can make this smaller. There we go. What the state calls non-infectious respiratory illnesses, or ones that are exacerbated by poor air quality. That could be things like asthma, pollen-related allergies, or as large of a data set like pulmonary obstructive lung disease. So that's why you kind of see the numbers on that specific, the air quality one on the gray in the far right. That's why those numbers are so high. However, you can see that there's an upward trend over the last several years. For heat, 2021 was the highest, but it has remained higher than pre-heat dome days. And then cold has risen and started to kind of plateau, but still at higher rates than previous seasons. And then we had the most amount of non-infectious respiratory illnesses in the last year. So when we actually compare this to data around what's going on in the environment, we can see that when the heat dome occurred, as well as other heat waves since then, we've had spikes when we've had multiple days over 90 degrees, and one of those days reaching the extreme, reaching the danger category for the National Weather Service. Those are the red dots that you see that are indicated with text. And so we know that the first heat wave, as well as very high temperatures, cause spikes to occur, and we want to try and obviously reduce those numbers. We can also see that during ice storms and different winter storms, we do have also spikes in cold-related illness. This could be things like hypothermia, frostbite, and some potential other cold-related illnesses. And then for non-infectious respiratory illnesses, things again that are exacerbated by poor air quality, we can see that when we start to reach the very unhealthy and hazardous, those numbers do increase as well. We can also see that the different environmental hazards do affect different populations. And so heat-related illness does increase with age. Same thing with cold-related illness and air quality-related illnesses. And you can see with the air quality-related illnesses that there is a higher number for 0 to 4, which is something that we're tracking as well. And then also by identified housing. So within this data, we were able to pull out whether someone was identified as experiencing homelessness or shelter or housing insecurity. And so we can see that for heat and cold, cold especially, there's a higher rate of those going to the emergency department for those two illnesses. But seeing how the count currently is about 0.5%, I think, of Salem's or Marion County's population, because this is county data, we can see that all three of these are higher for that population than compared to those who are not experiencing homelessness. When it comes to location, I pulled out the information for all of the different zip codes that are related to Salem data, and you can see that the 97301 number had a rate higher than the other zip codes. If you see a plus next to the rate, that means that in 2024, it went up compared to the average from the previous 5 years. So that's what those pluses and minuses indicate. For cold-related data, we also see that 97301 has a higher rate, exponentially higher than others. However, this is due to those who are experiencing homelessness are using that zip code primarily when going into an emergency department, because that's where they're receiving services. So when we pull out that information, we can still see that the 97301 zip code is still higher, but it's not as drastically higher when you're kind of looking at it with those numbers here. And then for air quality, like I had mentioned, in 2024, we had increased rates across the board. And so you see that those numbers are higher. And again, 97301 is the highest zip code in the county and in Salem area. So I just want to take a pause if anyone has any data related questions before I jump into the plan itself. I just wanted to pretext all of this with that information, so that way it gives you an idea of what we started with foundationally.
So I've heard this many times. Can you just real quick speak to how it was identified that people were classified as homeless and like what they would say for that?
Right. So in emergency department data, our public health department has access to a program called Essence. It is a syndromic surveillance program that we can get a lot of different bits of information from. And in triage notes or in provider notes, they notate whether someone is experiencing homelessness of some kind. And so when the data we code out, if this phrase is occurring, then it pulls out. So most likely the homelessness information is an undercount, because it's only if someone either self-identifies or the person who is providing services identifies them as homeless.
Yeah, I was curious, and you may not know this, does that data interface or get combined with the HMIS, the Homeless Management Information System data at all?
I don't think those two databases talk to each other. I know, yeah.
That's understandable.
That's a problem with data in general. Right?
I know.
I do know that we are using, the homeless count in order to get an idea of like what a rate could be, but we also know that that's pretty, highly undercounted too. So, yeah.
Can you go back to the slide that has sort of heat, cold, and infectious disease on one? As like, it's a pie chart.
Oh, these ones?
Next one, yeah, this one here.
Okay.
So I guess one of these things is not like the other, right? Which is cold related illnesses when you put it through the filter of homeless versus not identified as homeless. But I'm sort of curious, what's this a proxy for? Like, people came to the emergency room and that they had something that was heat related, cold related, or non-infectious, that you took those cases, and then I'm just trying to figure out what to think of it. Like, what does this mean to you? Because if it's during that time when there was an ice dome, during that time when there was a heat dome or an ice storm, or like tell me a little bit more about these pieces of information.
Yeah. So this is a part of the whole. So all of the cases within between 2019 and 2024 for cold related can also factor in if someone gets hypothermia during the summer because they're swimming, right? So we only pulled information for like the seasonal data, and it's just a part of the whole for seasonal between October and April, right? And when you do compare this to, let's say, age, or when you look at it like per month, you do see spikes specifically for the homeless information during those storms. It would be interesting to do a deeper dive into it, but I don't have more context, I guess, off the top of my head, so.
And one quick bit of information is in this region, there is less resiliency for heat-related illness than there is for cold-related illness. Most people who live in homes have some type of a warming option, and there are fewer people with air conditioning. So that's one of the reasons why the cold-related illness is more skewed towards those experiencing homelessness.
But I think your takeaway was all the 6.6, 42.5, and 1.4 are more than the general people who identify as homeless population in general. So you're saying that, well, homeless people are more susceptible per capita. But it also kind of seems like they're also particularly more susceptible to cold-related illnesses than they are heat or non-infectious respiratory.
Right, yeah. Yeah, that's definitely the takeaway. You know, I think it's helpful information because for us, when we start to do planning, we can look at, okay, if there's a initiative we want to move forward with for heat related, it might make more sense for us to focus our efforts for those who do, you know, incentives for housing, right? Whether it be rental homes, people who own their homes, single family or apartment. Whereas for cold, we might want to work on more like shelters and resilience hubs and getting to and from those locations, and education directly with people experiencing homelessness and working with those service providers who, you know, have more connections with those or with those people. So I think it's just kind of provides the context that's really helpful. And that leads nicely into planning.
Yeah, I guess I think there's, I mean, when I think about it, it's like, oh, well, there's a no duh element to it, but also having the data to support a planning decision, because chances are you don't have resources for all resiliency options. So.
Yeah. Yes, and that's one of the reasons why we've kind of focused on, and I'll get to that. Why we focused on having a collaborative plan, because as a public health agency or organization, we are only able to do so much based off of our capacity, and so we want to try and work with more organizations collaboratively to make a greater impact. So with this, and this is a slide I normally have with different community groups I've presented to. As I'm kind of talking through our climate and health adaptation plan, kind of think, where would your organization fit in? And if you did have funding in order to do something, where would you want to be involved, right? Funding is a big thing, and part of our plan specifically teases out having a subcommittee to try and increase funding and resources for organizations through grants or other state programs. And so that's why I posed that question.
Did you have a question too?
Yeah, I just had
Oh,
one
sure.
more data question, but so I was trying to go through here and I couldn't really find, and maybe in here I just may have missed it, but like a list of what was defined as a cold related illness versus a heat related illness. And the only reason I asked is because one of the hardest parts about pulling data from the era that we did, or that this is pulling from, is also you have COVID happening at the exact same time. So the data starts showing an uptick starting in 2020, which is also the time that COVID obviously came into play for so much of the medical field. And so knowing that we're pulling this from the medical field and from the data from the medical field, how did they extrapolate those out to make sure that COVID wasn't causing an increase in the respiratory issue or the cold related illness, whatever it might be?
Yeah, there's a list of those in this is the gray one, the air quality one. And it's based off of ICD codes for what that person is experiencing. And then it's grouped together, calling it a non-infectious respiratory illness. And so if someone shows up with COVID, they wouldn't show up in that as a data point there.
Because that's infectious.
Yes.
Right, I guess that's why I say, and I'm less worried about it with the air quality part, because I think that clearly it defines out the non-infectious part. It was more the cold related illness that I was more interested in, and if it's just hypothermia and trench foot and things like that I defined as cold related, then obviously it would have no impact. But if an asthma attack suddenly moves into the cold related illness aspect, because asthma attacks are also compounded by cold, right? But they're also compounded by COVID. I guess that would be the question, but I don't see the actual definition of
Definition.
what comes into those in the cold related illness packet.
Yeah, if it's, it should be, but if it's
It
not.
may be, I may have missed it. Don't miss me, yeah.
If it's not, I know that it's defined in the climate health adaptation plan.
Okay.
Yeah, in the definition section.
No, I got it.
I had one data, but so sorry to bother you, but I was trying to understand some of the slides. When you're talking about visits by climate hazard metrics, on one slide, there was urgent care and emergency, and on the rest of them, they were emergency room. And I was just wondering if urgent care was included in all of them, or if there was a particular reason it was just in that one. And I'm assuming these are urgent care and emergency rooms throughout Marion County, not just in Salem.
Yes,
Okay.
yes, so it's both, and we did a retitling once we did the climate and health adaptation plan, calling emergency department and urgent care visits just emergency visits. So it combines both.
Okay.
I should have corrected that on this slide.
No, that's okay. I just noticed, I was just asking just to be clear.
Yeah.
Thank you for the explanation.
Yeah,
That's
no
what I
problem.
needed.
Yeah, we try and simplify the language a little bit, so that way it's not so much of a mouthful. Especially when I have to talk about it, but then it allows we try and put a lot of the information in the definition section of those, so that way it hopefully makes more sense.
Well, and I was wondering then if the demographics changed by location, urgent care versus emergency room. I'm a data analyst, so I start looking at it and
Yeah.
saying, what is this telling me? So thank you for the explanation.
Yeah, I get you. So with our climate and health adaptation plan, it's our mission to try and improve public health outcomes during periods of extreme heat, extreme cold, and poor air quality for all Marion County community members through emergency preparedness and resilience strategies. We settled on those three climate hazards as ones to focus on with our goals. Because through our environmental scan process with Willamette, they did a survey asking people, what are the things that are most concerning to you? Those were the three environmental hazards. And also we have data from public health data from Oregon Essence that provides that information for us to start with a baseline and then try and make some improvements. And so that's the reason why we chose those ones. We did look at other things like flooding, water quality, and a few other environmental hazards, but we ultimately decided on those. Our goal through the different strategies that we implement through this plan are to reduce heat-related illnesses on heat index days of 90 degrees or higher by 20%. So a reduction there. Cold is a 20% reduction based off of wind chill days of 32 or lower, and air quality is 1% or lower. The reason why we chose 1% is because the rates are so much higher, and at that time we didn't have a comparison with the actual hazard for when people are experiencing that emergency. So those are the three that we chose, and we tried to link them to the environmental hazard that has the effect on human health. That's why you see heat index relating air quality or air temperature and relative humidity, and then wind chill factoring in temperature and wind. Regarding involvements with this presentation, I wanted to show, sorry, that's misspelled. City of Salem, and the, which ones we've kind of discussed have some, support or programs that through the CAP, have some connections. And then we as a health department have some that we take a lead on. However, like I had mentioned, this being a collaborative plan, we also have various ones that we are supporting or monitoring to see how those efforts are going with other organizations working on aspects of this plan. So we have 6 strategies. Trying to increase resources for families and individuals, trying to increase and enhance resilience hubs and shelters, trying to reduce heat exposure in the community, communications, which is a big one that we're going to take a lead on as the health department, general preparedness and resilience, which I'll get to, and then some quality improvement projects that we have with our health department. With our first strategy, resources to individuals and families, this is mainly around climate-related resources. So air conditioning, heating, air purification, generators, or mini fridges if someone has a specific health need. If the power goes out, would that cause extreme burden to that person's health? And to focus on specific priority populations. So for instance, older adults is one that we've teased out with its own objective, and then low income households as well, being, let's say, rental homes. And with those numbers you see, those are the individual objectives that we want to try and make changes to. So we want to try and enhance health-related social needs, access and distribution. This would be things that people can apply for through Medicaid and through the Oregon Health Plan. Any priority population, regardless of Medicaid status. So providing resource distribution information to older adults is something that we've connected with Salem Center 50+ on, and that's why you see that highlighted here. Support Salem Center 50+'s Fix-It Brigade. There is actually going to be a grant coming out at the end of next year, the Healthy Homes Grant, that is specifically targeting increasing kind of repair and home improvements to older adults. And so that's going to specifically help that objective, working with Salem Center 50+. And then also to do some recommendation of home energy efficiency improvements, assess and recommend radon testing, something we're a project we're looking into with Salem Kaiser Public Schools, and then to assess personal emergency equipment and medication stockpiling, something that we saw coming out of various conversations with our environmental scan. I don't know how I'm doing on time. I apologize if I'm going over, but we're okay.
Oh
Okay.
yeah, have at it.
Okay.
I have,
Go ahead.
Yes.
thank you. I just have a question on the radar testing. Are you also then thinking about figuring out ways if radon is high in these schools or homes, if there'll be some support for the mitigation equipment?
Yeah, so I would say you kind of think of this in tiers, right? If it's a kind of an assessment, we're starting at the very beginning and then trying to get a baseline of information so that way we can move to the next step, which is either planning or some sort of implementation of the plan.
Thank you.
Part of that obviously also comes with funding, and the data will help us try and go out and get, grants or other types of state funding. And so this is just like, let's start at baseline one and then go from there.
Can I ask a follow-up on that? So I understand radon to be a public health issue and tied to cancer. I'm curious, I don't know of a connection between radon and climate resiliency.
Yeah. The idea behind radon is that if we have an air quality event or heat or cold, right? People are going to be spending their times in their homes, and radon is the second leading cause of lung cancer in Oregon. And so we want to try and make the home inside as kind of safe as possible for when we have these types of events. So. Our second strategy is around resilience hubs and shelters. We want to try and increase resilience hubs and shelters. This would be to ensure that hubs and shelters have proper air filtration. So if, let's say, again, we have another wildfire and evacuations going, making sure that where people are going has good air. To create a neighborhood resilience hub or hubs, a lot of community groups and neighborhoods are really interested in this specific strategy. And so I can definitely see this one growing and getting some momentum. Creating a housing hub, something that the Mid-Willamette Valley Homeless Alliance is looking into doing, to try and enhance current resilience hubs and shelters. And so supporting shelter volunteers. Willamette University is looking to explore appropriate shelter opening thresholds for low, high temperatures and then air quality. They're gonna look into not just the health impacts, but also what the economic impacts to those organizations providing those services can be. To promote creating opportunities, free disability services training. So this is specific to shelter volunteers, but this is a service that's provided to any organization through creating opportunities to help support and teach people about how to service those with disabilities. And then transportation to and from shelters. We've worked with Chariots to try in the next 5 years promote their paratransit and lift services. They do provide free services to and from shelters and cooling centers. And so that is something that we want to try and educate people on, and then also explore free transit for poor air quality days, as well as extreme heat and extreme cold. So those are the things that we're kind of looking into around resilience hubs. I will note that I didn't put it on these slides, but we are trying to also help the city of Detroit and Santiam Hospital create resilience centers themselves. And so if that's ever something of interest to organizations in Salem or the city itself, then I'm happy to connect on that. Any questions on resilience hubs and shelters? Community heat exposure reduction. So with this one, we know that Marion County, through an Oregon Department of Energy cooling needs study, Marion County is the 4th most vulnerable county in the state for heat vulnerability. And so in order to understand it, we want to try and do some assessments around it. Heat mapping is something that some communities like the Portland metro area and Bend, maybe? I'm trying to remember where else, have done mapping to see which like specific blocks and communities have higher heat exposure than others. We can look at surface temperature and shading from trees to give us an idea, but doing an actual assessment to see, which areas are definitely hotter and which ones are cooler will give us an idea of where can we target with limited resources. So Juliana had mentioned that there's a project going on through Willamette with you, and then Willamette is also looking to expand those efforts outside of Salem too. To increase shade infrastructure, so this could be tree canopy, this could be, let's say, shading around bus stops or to and from bus stops, things like that. So that way people stay safe during heat and cold, and also to educate the community itself around why these shade infrastructure benefits are good for communities. And then to also support environmental youth programs. We had Isaac's or Icebox and Willamette as a part of our planning committee. And so we wanted to call out to try and enhance their efforts. Isaac's Room or Care Corps does a summer project to increase environmental improvements and mainly in Salem, but in other areas too, potentially. And Growing Oaks is a student-run club at Willamette that grows oak trees and then gives them to organizations who would like sapling starts. So just wanted to call out, yeah, we also try and work with some youth organizations too.
On the heat mapping assessment, is that just physical infrastructure and shade? Or are you actually assessing which buildings don't have air conditioning? Because that seems to be what kills people in prolonged heat waves, no matter where it happens in the world.
Yeah, this would be like outdoor mapping. So how it works is there would be little sensors attached to a car, or I've actually talked to Chariots about this. They were open to having like putting them on buses, and then they drive around at certain times of the day and then record it. And then that will tell us, which areas have higher heat exposure. When it comes to air conditioning, there's only like very limited data that we can pull from. Like 10 years ago, the city of Portland did some sort of a survey and based the rate off of it, which honestly, when I looked at it, I was like, this doesn't seem super accurate to me. So they're looking to do it again. I just learned from their coordinator in Multnomah County. So it would be interesting to see how that goes. But yeah, I think that it would be great to know where air conditioning is and how we can try and improve that.
Yeah.
That's a tough study to nail down. Okay, so for communications, we have a pretty heavy lift on the communication end. We're looking into developing a community champions network of all of our organizations involved in this work to kind of share information. We can share emergency notifications, like educational campaigns to try and really improve the reach of those of that messaging. We are about to roll out with some cold-related educational information, and once we have this network set up, it'll be really easy for us to share across our network. To also ensure we have a wide reach of communications, whether that be through accessibility, through language, what types of communication we're using. So for instance, if we're trying to communicate to farm workers, we might use Spanish radio compared to older adults who might read newspaper more, right? So just examples of how we want to make sure we have a wide reach of communications and to develop a communication plan that goes along with that. And to encourage Marion Polk alerts during our outreach efforts to make sure people are properly informed when an actual emergency is occurring. We also have talked about enhancing power outage communications through utility providers. We did have Consumer Power at our planning table, which was really helpful to get that perspective. So. And then some things that really didn't fit nicely into the other strategies, we call it general preparedness and resilience. Like I had mentioned, we have a funding and grants committee, and we want to try and improve funding opportunities for all organizations working on our objectives, to host ongoing implementation meetings. We have an implementation meeting next week to continue working on and tracking how we're doing in improvements and evaluating those efforts. Host a preparedness and a resilience summit to increase organizations' resilience and response plans. That's something our emergency management team with Marion County Public Works would like to do within this 5-year period. And then also some additional efforts. Marion County is an agricultural hub, but we don't have a pollen monitor in the area. It's either Eugene or Portland, and Portland one isn't even that great. So I would like to look into trying getting a pollen monitor here, so that way we can track that. And then also to conduct mobility challenge campaign with Chariots and supporting Shangri-La with backup generators. That was something that they were looking into doing for their clients. And a CERT, try and do some outreach to CERT programs because we've had limited involvement there. So those are the majority of our initiatives and objectives. We have a lot of different moving parts for action items with many organizations having some sort of role within many of these. However, if there are some potential opportunities for either partners of the city of Salem or other effort or areas that we see, happy to connect on those. We do have a public facing website that has accessible as we can get right now information. We have it in multiple languages that you can have translated, and it provides information on resources for families or people who might have different levels with, let's say, extreme heat, extreme cold, or air quality, and then water quality. And we have a resources page that breaks things down by population. So let's say older adult information specifically, or by language as well. And so we are trying to navigate people to use our website so that way we can try and increase information there. And then we also have a public safety power shutoff page. It's basically just mirroring what our utility providers are doing. Oh, that doesn't work. That's not good. I'll have to look at that. And which websites they can go to. You can see Consumer Power has a map of where locations are shut off, and that's just an example of us trying to increase communications. This is supposed to be PGE's map, but I guess we need to look at that. Anyway, that is kind of what I had prepared for everyone. Are there any further questions or questions from people online? I know I didn't see any hands, but
I'd just follow up. I appreciate the talk about power at the end. In my experience, when I was on Grand Neighborhood Association and talking to community members through both the ice storm and the heat dome, the problems that people face are often connected to losing power, right? Whether they lose heat or they lose air conditioning. And I remember at the time, one of our board members who, lived across the street, she was blind and had difficulty getting from place to place, but, she was working at the time to try and see if there was some way to improve the resiliency of just her apartment building, or if there was, at some point she got excited about the potential for the state to mandate a solution for apartment dwellers or apartment owners. I know that never became anything, but when I think about resiliency, especially in 97301, you have a lot of old buildings. They don't have air conditioning. They're in a part of the community that's really susceptible to power outages. And so when I think about your metric in terms of wanting to reduce the number of visits, it seems like some of your strategies are going to be more impactful than others in terms of actually getting to that number when the next thing happens. And I think focusing on power, focusing on apartment buildings where you have a lot of people at once would be an improvement. And then this idea of connecting to CERT, I think, is also very interesting because when most people think about CERT, they think about the Great Shakeout, what happens after an earthquake. But I don't remember our local CERT in the Grant neighborhood being activated during the heat dome or the ice storm.
Right.
And that would be a very useful time for them to be going door to door to check on whether people still have power, whether they have air conditioning, and to get them connected to resources. Because that's what they're really good at, door to door checking.
Yeah, again, a lot of these efforts really kind of depended on who was able to, come to the table. Luckily, we did have some, power utility representation. I tried to get some of the others within the county to come, and we just didn't have any success there. No fault on anyone. I understand that, this is potentially a subject matter that may be lower on the totem pole compared to other potential issues. With that being said, though, I kind of see this as this plan as a opportunity to really try and increase those connections and collaborations. So that way, if we're able to help within the health department itself, then we can step in and provide, whether it be data, help with planning, provide a public health perspective, or to also help with the actual, initiation or implementation of that effort or program. And so, we also wanted to try and connect with CERT because we did have some limited success there. I reached out to various CERT leaders and just didn't get any follow-up. Again, it's definitely can be due to other priorities. So the goal with this plan is to try and increase capacity without trying to increase more burden on any one organization. And so that's why we are taking the lead on some things and then also trying to work on collaboration and support on others. So.
Nice question. And honestly, these are two things I would have never linked together. But so while we were sitting here, I was trying to think in my mind, like what other communities in the country would have obviously even worse circumstances than us. And so I went to Arizona, right? Let's see, Maricopa County, right? So they did their same climate assessment and came out with the exact same results when it came to much higher temperatures, much colder temperatures, even for them. And they're obviously dealing with not just the number of visits they've had related to these, but they're actually dealing with deaths that they're tracking, which are horrible numbers. But one thing they found was that 57% of all their heat-related deaths involved substance use, where people were obviously utilizing substances and then passing out, and then they were exposed to the weather for a longer term, both in cool and in heat, right? And so did ours look at that or link that in any way as we're kind of looking at that public health aspect?
Yeah, that would be an interesting thing to look into. The Essence data, we can take a look at it. We do need to get permission from the state whenever we do a deeper dive and actually publish any reports on it. That's one of the things that I kind of wanted to start looking into is what are some of maybe the secondary effects from these environmental hazards. And I know heart disease was one that we wanted to look at. Same thing with lung when it came to air quality. We did drill down to asthma and pollen related allergies within the air quality one. And so now that we're kind of in the initiation of the plan itself, I have a little bit more time to. I'm a department of one, right? So,
Right.
So
Let's keep some more work on you.
Yeah.
We have tons of it.
Let's deliver great ideas.
I think that's really helpful to look into, and that ties into our county's community health improvement plan, which has substance use and mental health overall strategies and goals to make reductions there. So I appreciate that feedback.
Thank you.
Well, that's been really informative. I just wanted to ask Councillor Nordyke, since we haven't been able to see you on screen, did you have any questions?
Yes, and I have had my hand raised, so
Okay, sorry
So
about
we can't
that.
see you.
I'm sorry, I didn't realize you guys, because I can see my video and yours, so silly me.
Okay. Sorry, now we see where you're at.
Sorry, pal.
It's all good. It's all good. No, first of all, I'm really excited by this presentation, and I appreciate all the questions and comments by my peers. I'm shocked that we're literally the grassy capital of Oregon, and we don't have a pollen indicator. I'm a pollen indicator of 1 every June, by the way. I have hay fever, and I can tell you when the pollen count is high. But all jokes aside, I find that this is really great. I know that you're applying for grants. If there's anything that perhaps we could do to write letters of support I think perhaps, sometimes grants ask for letters of support from other collaborators or stakeholders, whatever. And that's always something that I think you should keep in mind. I think this group would be receptive to that. I also really like Councillor Tigan's comments about, making more connections between the neighborhoods and our certs and resilience. I feel that that's kind of an untapped opportunity to really get people oriented in the same direction when we have extreme weather events, which they do happen, and we have had a lot of people adversely impacted by them. So those are just my comments at this time. Thank you.
Great, thank you.
Councilor Varney, I have a question, if that's okay. You might not be seeing my hand up.
Please go ahead.
Okay, thank you so much. So thank you so much for the presentation. And my comment is, you talked about, I think one of the slides, developing stronger networks among partners to be able to kind of serve better in these situations. I just kind of want to talk about, from a communication perspective, I think misinformation spreads very quickly. And I think when it comes to emergency, it's important that we talk about that single communication channel and to make sure that all messages are accurate and consistent. And it's also important that the community has the most relevant information. Often when we are responding, we know what we are responding to, but nobody really talks about where we are at after that, right? So leveraging media and our other partners and making sure that we are all kind of acting as one unit, and so that there is no misinformation in the community, I think is important. You might have already covered it, but it'll be great if you can talk about what efforts are in place to make sure that the communication is consistent.
Yeah, thanks for pointing that out. I think coming from the public health perspective, during COVID-19, we definitely learned that there's a power in sharing a message to trusted organizations, and then they provide that message, and having it be a cohesive one. And so that's kind of a borrowed tactic where we want to have very simple messages, no higher than 6th or 7th grade reading level, and utilizing a lot of different efforts, like I had mentioned before, whether that be through social media, which has some reach, but its limitations, through radio, through print, through community newsletters, we have some video developed, whatever the communication channel is that we can try and put a message out there that's consistent. We want to try and do that, and really working with organizations that are tied into this work, help spread that message, then increases the level of trust someone will give to that message too. I specifically worked as a PIO during emergencies. I'm our deputy PIO for our health department. And one thing that we kind of know is that it takes, on average, 7 times for someone to see a message for it actually to sink in. And so the idea is to kind of try and get as much of that message out as I guess, flood it out into the communication channels as you can. What we're currently doing is we have it's a CIRC plan. It's a crisis and emergency risk communication plan. And we have different levels of when specific communications might go out. So if, let's say, in May, we'll have an educational campaign. I actually just dropped off some flyers to Juliana and some posters, for HEAT. Just an example of consistent message and for one specific type of communication. And so, we have different tiered levels of when something might go out. If, let's say, we have a day of 100 degrees or higher, then we'll have way more communication go out, potentially even a press release for a warning, right? If there is one. So, we do have plans there, but with our kind of communication plan for this entire climate and health adaptation plan, we want to wrap in efforts and work with not just our health department, but other organizations involved. So I would say we're taking definitely steps to making it a wider reach, and as we build out more and more partners to work with us, we're increasing that reach.
Anything else?
Great website name, mchealthy.net.
Yep.
Might be a trademark issue.
Make
the
healthy.
gold I don't know.
Yeah, it's pretty fun to say that.
McHealthy.
McHealthy.
Yeah, yeah. Well, fantastic presentation. So much information, really.
Yeah, thank you.
I appreciate that very much. Okay, next on our agenda, Councilor Knightley.
Yeah, I'm wondering who's a Mariners fan in the room, because it would take 7 times for a message to sink in. Maybe they won't.
Maybe this
pitch-
one will make it.
Maybe they won't pitch to Vladimir Guerrero tonight after watching him hit 7 home runs. Well, I just was put on the agenda to give just a debrief from the time I spent in New York City about a month ago for Climate Week. So I didn't prepare any slides or anything like that. I just thought I'd walk through it. What's that? Slacker, I know. Well, for folks who don't know about Climate Week or what it is, I'll give a little bit of history about it and what it looks like now. And I've been a couple of years now, and just kind of talk about year-over-year changes and then kind of facets of things that I saw while I was there. But Climate Week started in, I think it was about 2009. And it really started as a sort of organic activist event that was planned in New York City the same week as the UN General Assembly, which is already a very busy week in New York, where people from all across the globe come to participate in the big yearly United Nations gathering. And the goal there was to call world leaders to the carpet and have them make commitments to climate action. And it's happened every year since then, the same week as the UN General Assembly, but the character of it has changed over time from activists sort of demanding action to governments, corporations, philanthropists announcing what their next step in climate action was going to be. So it's kind of gone from this sort of edgy activist people in the street to all the way up on, the 80th floor of the downtown skyscrapers and the people who, pull the levers of finance across the planet, deciding how they're going to make money on climate action. And that's just about as cynical as a way I can put it. But honestly, that's really what it's turned into. And that's kind of, in my experience, having gone to it both last year and this year. Last year when I went, the rooms that I was in, a lot of people were talking about how big companies, governments, philanthropy, and really in a lot of ways government, were going to be funding financial instruments and things like ESG commitments, environment, sustainability, and governance goals that were put into corporate earnings statements and things like that as a way of pushing climate action forward. So an organization like Coca-Cola would make a commitment to sustainably source water. They would put that into their investment, outlooks and things like that. And that's the way that true climate action was going to be both put forward and held accountable. Well, what a difference a year can make. When I went last year, it was August of 2009. There was a lot of interest and movement on these fronts. And then this year, if you remember a month back, it's hard to remember a month back in the news sometimes because so much happens in a month. And forgive me if some of this seems pretty political, but it was the week that the president went to the United Nations General Assembly, called everything a hoax, and, essentially called every world leader to the carpet in his, unique way that only he seems able to do, and then left. But what has really happened before that, in the 9 months before that, was a massive disinvestment in this work, both across the United States, by the federal government, but then also sort of an international response as well. And so the rooms that I was going into, and the way that Climate Week works, it's not a conference like, the Realtors Trade Association where everyone gets together in one place. Really the entire city is the conference, and you kind of get invitations to different rooms and different events happening, and you just kind of have to put together your own calendar, as it were. And so the kinds of places that I was going to were, people were really, in some ways, like coping with the lack of investment. They had thought by this time last year that they would be working on a big water project or working on a big climate project, and that money may have been pulled away. And so you could really just sense kind of the tension across the entire city, just in terms of who was there and the topics being discussed. And then also just, something like group coping with the change in the situation and how fast it was changing. For folks that our team works with for my company, things like canceling Inflation Reduction Act grants, the bipartisan infrastructure law, those were very big investments in climate resiliency and things like that across the country that aren't going to be there anymore. Internationally, and some of the companies still have ESG commitments that they're committing funds to, because maybe their stock is traded somewhere else or something like that. So there's definitely things still happening, but the other really interesting part about it is a very international conference. And so talking to people about their perceptions of the United States and what the consistency of climate action looks like over the course of a decade is an exercise in diplomacy, we'll say. So just in terms of some specific rooms that I spent time in that I think have some relation to the climate action plan. There's a consultancy that does urban design called GEHL, which is GEHL, and very interesting group that has I think a European office, a New York office, and a San Francisco office. But they were talking about how urbanism, sort of the future of urbanism and city design, is really connected to climate adaptation. And GEHL, like one of the projects, I talked to the guy who moderated this conversation, but they have two projects in Arizona where they're trying to sort of design whole communities that aren't dependent on cars in Arizona, which is pretty difficult to do. They're called cul-de-sac. And so we talked a little bit about sort of the difficulties of financing projects, because essentially this panel was about 6 or 7 people talking about things that every city should do, and honestly, we've already done in Salem. They were very focused on redrawing comprehensive plans, getting rid of parking minimums, a lot of the things that the state of Oregon is already foot forward on, and that Salem's foot forward on, as I would say. But after I talked to him, I was like, the thing you're missing is the then what? Like, how do you get the market to respond to build according to this, the comprehensive plan? This panel really seemed to be focused on, change the regulations and they will come, and we do see some development in Salem, but the transformation that it would take is going to take a long, long time. My house has been zoned to be a multifamily development, quote unquote, for decades, right? It's still a single family home in downtown. So it was a very interesting conversation, but it was really trying to inspire people to, you know, go back to their cities and tell them to change their zoning codes. Well, we've already done that. So I talked to them about, well, maybe next year, rather than the 101 course, you know, let's move to the graduate level course about how we get, you know, developers really interested in this style of development. Thanks to the kind of ongoing conversation with City of Salem, I was able to reach out to some of the folks with ICLEI, which is an organization that we're a member of, and it's about cities and sustainability. They provide us some tools to judge our own sense of progress with sustainability. Very nice people, and they had kind of named an international delegation of member cities, and I met up with them kind of twice. Once was just for a social hour and dinner, and that was very interesting to sit down to dinner with elected officials from across the world, and hear what is it like to be a mayor in Australia versus, you know, Athens, Ohio, or other places. And in Australia, it's called the Lord Mayor. Okay, so you're not just the mayor, you're the Lord Mayor. And the woman I met, she's the Lord Mayor of Adelaide, Australia, and they're sort of in the running to host the next COP, which is the annual climate summit. And so that was a very interesting conversation. And yeah, I think that was a great time to check on people's perceptions of what's going on in the United States and what they understand. And we also, of course, got into a conversation about measures, 5 and 50, and how in the world could you possibly fund your government like that? So they were fascinated by that. And then sort of the last one, the National League of Cities hosted sort of a roundtable event on climate resilience and climate resilience activity. It was kind of billed to be about wildfire and wildfire smoke, but I think a lot of the people who ended up showing up were from the Mississippi River region. And so we talked a lot more about flooding and about water systems, which, you know, we've got some climate issues when it comes to our water system. So I shared some of the stories of the things that we've been doing in order to try and build resilience in our water system. And they were very interested to hear about that and sort of the relationship between us and the Army Corps and kind of what decisions are at stake there. But it was really interesting to hear from communities along the Mississippi River about how much work they've done to articulate the economic benefit of living on the river, what comes from the amount of commerce that's connected to their river, and the functioning lock and dam system and things like that. So they also work with the Army Corps, just in a completely different set of interactions. And to hear people from as far up as Rochester, Minnesota, to all the way down, or not Rochester, but I guess Eau Claire, you know, on the Mississippi River where it's kind of skinny, all the way down into Louisiana where you can't see across it. Just really fascinating. So good relationships there. Salem isn't a member city of the National League of Cities, but they're very nice people and always looking for more members, as you can imagine. So I'll pass those conversations on to someone who makes decisions about it. I think actually sort of the one big takeaway, and Michael, I think this kind of connects to your presentation too, is that the other thing that I'm really sensing, having some understanding of this conference and just being connected to this conversation long-term, is that you can really sense the conversation shifting from we need to focus most of our attention on decreasing emissions to zero versus how much are we going to spend getting ready for what is clearly becoming inevitable. And in terms of adaptation and being ready for a very changing climate. And I think over the course of time, and even from last year to this year, the amount of time people were talking about emissions reduction last year to how much they're talking about adaptation and resilience is like a 70-30 shift from one year to the next. And I think some of that is political in terms of like, what are the messages that this administration is interested in hearing and might be interested in getting behind. And then I think another part of it is that, like your data shows, everybody is seeing 10 years worth of experience to say, wow, we can't just spend all of our effort getting rid of emissions. We have to be more ready than we are. And that's definitely a big part of this national conversation when you're in these spaces too. So. Happy to answer questions. That's just my take on the week.
I had a
Also,
question.
don't get in a taxi cab
Don't get in a taxi.
when you're in New York City during General Assembly and Climate Week. It's very busy. You'll just sit in traffic.
It doesn't go far or fast.
I was very curious about you mentioning Mississippi and the US Army Corps and the regulations that went in after Hurricane Katrina to requirements for dikes and canals, et cetera, to reduce flooding. And was there any discussion about the conflicting federal mandates that those regulations that the US Army Corps adopted, conflicting with ESA and the Clean Water Act?
They didn't go into it that deeply, I would say,
Okay,
in terms of like how they're interacting with the Army Corps. And it was more, I think they were talking more about the Riverway in general, and then along their city, you know, whether it was stormwater, moving stormwater out of the city, where does it go when the river's
Okay.
also up, that kind of thing. Those really sort of acute challenges during particular, you know, flood events.
okay, because those are definite challenges cities face at times. Okay, with the conflict, I'm required to do this, but then it has this effect that impacts, you know, this other federal mandate. So
Yep.
interesting.
Yep.
Thank you. Yeah, that was
Sounds
all.
fascinating.
Yeah.
Yeah, and to be clear, I was able to go, our clients and things like that for my work pay for me to be there, so, but you're there all week, and so if you have an extra hour or something, I can find, you know, that's kind of how I ended up at these City of Salem sort of quote unquote related events.
Okay,
So,
all right. Yeah, thank you. It sounds like very interesting.
Time check, I'm probably about 15 minutes. It's the quickest I could get that done. Can I steal an extra 5 minutes of people's time?
Everybody, okay, or if you need to leave, just leave. But I think we can handle that. Thank you.
Thank
Thank
you.
you, Councilor Tigan.
absolutely. Thanks for the opportunity to share.
All right, so I'm going to minus the people in the Zoom room, so please just shout out if you have a question. So we are in the Capital Cities Clean Energy Collaborative, and this is a program through ICLEI. And so all capital cities were invited, 20 joined on, and those cities vary drastically in size. So we have large ones like Austin, the largest at 1.7 million, all the way down to, I think Frankfurt is a bit over 28,000. So we have very big differences in terms of how big these communities are, various staffing capacities. Several communities don't have a staff and their only person on is their elected official. We're on the lower end with one full-time staff member, so thankful for that, but we still have one. And then there's some organizations like Phoenix and Austin that have entire departments, divisions, offices of sustainability. Then they have different organizational structures. So some of these folks are in planning, some are in public works like myself, and some are in city manager's office. And then the funding mechanisms, mostly they're through general fund and they're through tax. Some are through franchise fees from solid waste, and some are through utility rates. And more on the Clean Cities Collaborative. So ICLEI is partnering with the Klingenstein Philanthropy, and their specific goal is policy implementation, supporting organizations that help elected municipal and other local leaders and staff, as well as other specialists, decision makers, and practitioners efficiently implement and enforce decarbonization programs. They mostly do health-related philanthropy, so this is kind of a segment off, and I think it's newer, and I think that's partially due to the withdrawal of a lot of federal funds. So in this, they are looking to help communities select a clean energy pathway, and so they offered 2 tracks. One was vehicle electrification, and one was building decarbonization. Building decarbonization works a lot smoother with some of the other initiatives we're already working on, so we've selected that track. And then what we're doing with the technical assistance, so that's the staff times on those meetings, we are creating a individual plan policy. And so it's to create a policy roadmap, and we've done a readiness assessment. We're looking at budgeting, and they specifically called out Salem for admiring our PBP, priorities-based budgeting. And so very cool to get that shout out. And they, the next meeting will be on stakeholder mapping. And then we should have a complete workbook by around January for a 2026 policy implementation. We do not have to implement a policy. This is to try and get us there, and they're going to give us some technical assistance. And we're going to work on getting that policy there if we can. And then they just announced that funding was extended through next year. So when we're looking at policies, what do these policies look like? So looking back at the Salem Climate Action Plan strategies, we have mostly identified external strategies. External strategies take a lot more effort, work, and community involvement. I've got them listed out here if you have any questions on those. I did strike through the community green power rate from PGE. We've already done some work on that, and they are not going to be submitting that through the PUC, so that's kind of a non-starter there. And then we have the internal strategy. In addition to the external strategies, one that's not listed, but one that we're currently tracking through urban development is CPACE, or Commercial Property Assessed Clean Energy. So that one could also be an option. And then for internal strategies, EN 12 is developing a comprehensive approach to increasing energy efficiency in municipal buildings. This is something that we've been putting a lot of work and effort into. We are currently underway in our municipal energy master plan from the energy efficiency and conservation block grant. That was 100% funded, 0% match required on that. We are expecting a draft by the end of this year. I've reached out to our consultants on this, and I've asked that they provide policy recommendations in line with what we might be looking to adopt for this policy roadmap. In addition to the opportunity to work with the other capital cities, they wanted to provide a in-person meeting. This they are doing at the C40 Mayors Summit, and they are looking at having this on day 3 of that summit. And they have asked that our elected official representative, who is Councillor Barney, to be presenting Salem's progress at that point. So we're really excited to get to hear from her on that. And in addition to that, there are another couple of meetings that I wanted to just alert everyone to. So urban water resilience, adapting cities to changing climate, waste reduction, cutting methanes and creating jobs, climate finance, unlocking urban investment, energy transition in practice, decarbonizing cities by 2030, and public transport, electrification, and transformation. But all of them sound incredibly exciting. Very excited to be going on that.
Those are all just events at the panels at the C40.
Those are the ones that
Correct.
we registered for.
Those are the ones we registered
Sweet.
for. We split things up that were
Wow.
most applicable to the
Great.
city of Salem.
And then plan implementation updates. So we have the Stride Smart funding, again, 100% funding, 0% match from the Bloomberg American Health Initiative Network of Practice Grant. And this is on creating public service announcements around pedestrian and bicycle safety. We've been holding stakeholder engagement meetings to identify the messaging And we've been able to leverage some internal and external resources to make that as impactful as possible and kind of extend that amount of funding. So we've had some help from our communications division, and we also were able to get Tila, our intern from Willamette University. Do you want to give a quick?
Sure. Hi, my name is Tila Hooper. I'm a student at Willamette University. I'm in my third year there. I'm studying politics and history. So I'm taking a class at Willamette that matches interested students with related internships in the local government. So this was the internship I was assigned. So this semester I've been working here with Juliana on the public road safety campaign, the PSAs, like we said, focusing on designing 3 PSAs directed at elementary, middle, and high school age students. So one for each age group. Each PSA is going to be about a minute long and be able to be broken up into 20-second long sections so they can be distributed on social media as well. The campaign is centered around kind of like the idea that students know their role in terms of public safety and road usage, dividing it up between pedestrians, that's focusing on like visibility, using the crosswalk, that sort of good stuff, making eye contact with drivers, cyclists wearing high visibility gear, being aware of cars, and then drivers for high school age students, but then also using public transportation and then being safe around cars for younger students as well. In the PSAs, we're focusing a lot on visual messaging, so less like reading text off of the screen and more like just showing what, like demonstrating positive actions that can be taken by students, making sure that they know like the specific actions that can be taken, that they're doable for each of the ages that we're focusing on, making sure that they're prescriptive and kind of general instead of, or not prescriptive, so that they're more general and not insanely specific. So like the example that we've been using is slowing down at turns instead of like sticking to a certain speed limit that can be kind of limiting. They are focused on kind of creating an emotional appeal for students, not necessarily scare tactics, don't want to, freak people out, but just being like, be safe on the road. It's a smart thing to do. So yeah, it's really cool. Exciting stuff. Yeah, thanks.
And so we're thrilled to have her as part of her internship. It is unpaid, so she is here just helping us. And then speaking of unpaid people who came to just help us, we had an international fellow from the Professional Fellowship Program. That's part of the U.S. Department of State and the American Council's Professional Fellowship Program. Her name is Serena. She was here from Moldova for 4 weeks. She just left, she actually left yesterday, so very sad, but it was wonderful to have her while we had her. She was here for 4 weeks, and not only did we have her, but a fellow from Armenia and a fellow from Ukraine also helped with coming together with a really incredible program, project. So they helped us, Oregon Department of Energy and Senator Solomon's office, and they together combined and created a building performance standard roadmap and checklist, so that can be worked with internal stakeholders and external stakeholders to kind of give the highlights of the building performance standards implementation and how we can engage people around knowing what those requirements will be. And then they, as part of it, they also applied for a reciprocal fellowship. And that was at the Great American Shakeout. And then we have just a quick update. I'm going to try and go as quick as I can on this one. The Community Renewable Energy Grant Program, or CREP, from Oregon Department of Energy. We got $100,000, 0% match for a conceptual design of the hydroelectric inline turbines. And I'm going to toggle between these two. This is the locations, Franzen Reservoir and Turner Control. And what we were looking at was for two sites, and the Turner Control is 1 turbine, the Franzen Reservoir would be 2. And before we got into the conceptual design, we were given a ballpark estimate of $3 million. So we were like, okay, $3 million, we can look into this. And then when we got the conceptual design back, they were like 15 million. There are a couple reasons that things ballooned, but that was simply more than what we were expecting. So we also looked into valve replacement, like if we're out there, what if we go ahead and we do the valves? And then Franzen Reservoir, as you can see here, it's at that bottom over there, it's on the slope. There would have been a lot of other construction that would be going into that. And so there were a few reasons why it really ballooned, but that was not what we were hoping to see out of that. And so we got funding for completing 60% design for the 2 locations. We withdrew our funding from the Franzen Reservoir location, and we're just moving forward with the Turner Control location. And so we, in kind of essentially giving back the $200,000 that allows it open for others, we gave it back without prejudice. So if something drastically changed in the financial landscapes and we were like, oh, we could pursue this project, we would be eligible to reapply and we would still be a good candidate for receiving that. And the reason why we're moving forward is we still think that Turner could be viable. There are some funding that make it possible. Direct pay is still intact for specifically hydro through 2030. The final round of CREP is expected to be end of the year in 2026. And the CBRE, or Community Benefits Renewable Energy Program, through PGE, is where they would basically allow it open for people to propose ideas, and then they would kind of bid on. It's a reverse bidding situation where they would pay you for the energy produced. And so we're also going to look at an alternatives analysis, but it's significantly scaled back from the conceptual design of the original proposal. And then I have the kilowatt hours and pressure for all of those, but the Turner Control, more megawatt hours, less infrastructure. That's, I think, the main takeaway from that.
Yeah.
And then the Get There Challenge was October 1st through the 14th of this year. And so we had significantly more participation than we did last year. And part of it was that it was 2 weeks. We had better weather, so maybe climate change is helping in some things. And then we had an internal green team help promote with this. Our wellness staff was able to provide 500 Wellable, that's our health incentive points for people who participated. And we had city leader promotion of this, including Brian, Director Martin, had sent out to Public Works staff on trying to get people involved. Right after that email sent out, 4 more people registered, so I think it was really helpful. And then the next year we want to look at earlier promotion, more of a social component, maybe more internal competitions, and then Chariots is offering swag, so maybe that'll help people get involved as well. And then our next meeting is December 15th, and it was 5 minutes over on the dot.
Good job, good job.
Amazing, amazing.
Don't take out any of the words, just all the spaces between them. You're fine.
I don't see any questions online.
Go ahead and stop sharing.
So, that was fantastic. Wow, that's a lot of information in
5 or 10 minutes, whatever.
whatever it was, 10 or 15, 10 minutes.
Can I ask a question about with the renewable energy grant programs? So the conceptual design part, we didn't have any actual cost that was associated with, but I assume the actual implementation of moving forward with the Turner aspect of it, we will have some associated costs, but 40%, is that right?
So 60% of the, we're looking for a 60% design. Of that, we would only have to do a 25% cost share for that 60% design. However, I was able to leverage our previous $100,000 as our cost share, so it should theoretically cost nothing for the city.
And that's for the design aspect, and then for the actual, so at what point in time wise, like would this actually be into where we're actually putting this product? I don't even know what it is. Yeah, when are we actually constructing?
Turbine?
We aren't committed to constructing anything. We are doing a 60% design. We're trying to have something shovel ready or as close to shovel ready as possible, so that if that's a good project, we would be able to know more about what that cost would be, and then we would have a timeline at that point. Just want to add on.
Right, and we'd look for more grants for that as well, if we could, but right now, we're not sure that it's even gonna pencil out. So that return on investment, you just saw the costs were so high, it didn't have look attractive, so we'll invest nothing of our city money until we know for sure whether it's worthwhile or not.
Okay. That makes
Thank
sense.
you for being such a good steward financially.
Yeah. Any other questions? I don't see anything, online. Well, as you said, our next meeting is December 15th. So if there isn't anything else. meeting- Oh, did
The
you have some-
meeting on December 15th is going to be about CPACE. I would really appreciate it if everybody could attend. They are trying to put that to city council as a whole that night. If you can't make it, I might see about rescheduling earlier rather than later. So if you can't make it, please let me know as soon as possible.
Okay.
Sorry.
Oh, no worries. No, appreciate you bringing that up so that we all know. Planning on being there. Okay, thank you. Well, the meeting is adjourned then. Till next time. Thank you. Wow.